terms of the COVID situation, we've had a robust response to the pandemic, and we are among the top 3 counties in the country in terms of availability of beds and also availability of well-trained staffers who are able to handle the situation. We find ourselves in a tricky situation because our location close to the capital city and at the center of the metropolis the outcome is that we are attracting patients from as far as Machakos, from as far as Nyandarua, Murang'a, and partly also from Nairobi. So the disease burden is high, particularly COVID disease burden, but we are taking it in stride, and we are doing quite well. We can commend the department because when the pandemic struck in March last year, there were no structures in place, and the response had to be unstructured for some time. But soon after, we challenged the department to formalize the procurement systems and also how they went about utilizing funds and training staff to respond to this pandemic. We are hopeful again that in the month of June we will re-embark again in vaccination because for countries that had been able to do over 90% vaccination, they are opening again. It's our aspiration to have a facility in every 5-kilometer radius, and in this case this would be a level 2 or rather a dispensary facility to make sure the day-to-day ailments and injuries are treated at source. We have projects that are ongoing in that regard to make sure that every other 5-kilometer radius there is a health facility, and that would imply every other ward should have a dispensary to handle the general disease burden. Particularly for COVID, studies have found that clustering the patients in specific facilities is advantageous because then you have an opportunity to lay down proper protocols for how patients are handled and how you maintain clean corridors and contaminated corridors in a particular facility. If we were to provide those COVID-related facilities in every dispensary, in every level 3 facility, it would be chaotic because we are not able to control the quality of services offered. We've taken our oversight role very seriously, and oversight in this regard is ensuring that there is value for money for every coin that is allocated to the department, either from our own source revenue or from the shareable revenue from the exchequer. And in this regard, we are looking into how funds that were initially expended or rather allocated to the sector of health were expended, and whether that was done within the parameters of the public procurement laws and also the Public Finance Management Act. We have about 4 requests for statements pointing to that regard, and the committee on its own motion also has as well commenced an investigation, and we have a draft report on how funds were expended. The committee has been able to registrate 2 major registrations, the Kiambu County Health Act and also the Kiambu County Facility Improvement Fund. The Health Act has set out modalities of licensing health facility, modalities of running our own facilities, and also modalities of addressing complaints through a joint committee for quality assurance, and also modalities of corporate governance for all public health facilities, either through health management committees, through hospital management boards, such that there is a laid down an agreed formula of managing healthcare in the county Facility Improvement Fund, on the other hand, has designed a way in which own source revenue generated in level 4 and 5 facilities is taken back to the same facilities to ensure smooth running of the facility, and this revenue, when it's taken back to this facility, it ensures that there is a seamless formula of stocking and restocking those facilities and addressing the minor procurement issues. That would be a game changer when fully implemented. So those two would be, in terms of registration, the major hallmarks of achievement for the committee. We've introduced impromptu site visits and inspection tours, which now again have the two have revolutionized the way management of health facilities is done, because you don't know when the oversight committee is going to visit your facility. So you have to be in tip-top shape every other time, because you don't know when the supervisors from the assembly will pop in and check. Currently, we are working on the quarterly report and also the annual report from the health services sector, which has just been laid in the assembly, and it is in that report that the CC will go through, now goes through his main achievements, challenges, and the shortcomings. And then we debate it, and then we summon him to the committee. We prepare a report for the sector, which we are meant to lay before close of this financial year. The areas of the Health Management Act in Kiambu and the Facility Improvement Fund that have been left unimplemented will form a large chunk of the debate that we are going to have. So we look forward to addressing those areas which have not been implemented and fully operationalizing the two acts which have been passed by the committee in this session.